Okay, so here's the deal. We gotta figure out why the clinic isn't working. Which is cool, because now we get to actually try out this. Alright, rooms. What do we say? Missing required rooms. Aha. The clinic is technically missing a restroom. Aha, that's why. See? I actually trampled the restroom there. There we go. Okay. At the same time, check the radiology. Yeah, the radiology now is working. Fine. So now we can unpause the game. Get out of this mode and let the guys come in. Let's see if they do come in. Treat 6 patients per day. Yep, the first ones are coming in. This room's still empty. I don't really care for it right now, so yeah. Okay, let's go. Oh, sorry. Let's see what I can do for you. Door looks a little floaty. It just occurs to me that didn't really put any place for the guys or the patients to sit down. Let me. Okay. Let's see how. Let's wait. All right. Let's see how. Sorry. How the patients resolve themselves. They stand. Okay, I thought they might get the little bench over there. Fine, let's put down a chair. Makes a lot of sense. The person comes to you looking for help and comfort, and you make her stand. Especially if she has some sort of pain, something on feet or legs. Makes perfect sense. Yeah. Okay, patients are gonna get the fancy chair. Let's put down 2 of them, I guess. Like this, like so, and like so. Yeah. Happy now, sit down. I hope you don't get stuck because I put the chair right on you. So you've been vomiting. Loss of appetite. Okay, you're proceeding to physical already. And let's. Okay, already. Schedule procedures, okay. So it's for sure chickenpox. Varicella is a highly contagious disease caused by the initial infection with varicella zoster virus. The disease results in a characteristic skin rash and forms small, itchy blisters which eventually scab over. Headache, vomiting, loss of appetite, muscle pain, joint pain, pools and vesicles. Yeah. Alright, so, boom. Let's see, Mr. Hall. Take some antivirals, amino ointment, and stomachics, and analgesics, and rest. My god. Okay, and rest. Okay. Can't move this window particularly. Fine. Doesn't matter. Let me see. Check your other patients. Mr. Green. You. Mary Hill. Robinson. Charles Brown. Oh man, Charles Brown, really? Man, the guy's Charlie Brown. Okay. This guy has anything on the has a ballpark of an existential problem or depression, and melancholy depression. Oh man. Sheet what? Oh, he's a factory worker. So the fate of Charlie Brown is to become a factory worker. Okay. All things considered, makes a lot of sense to me. Charlie Brown always had that conformist thing going on for himself, despite all his existential critics. Next. Okay, I noticed that I don't have enough chairs for them to sit, so they actually sat on the... Okay, let's try and change that at the very least a little bit. More chairs. Here, let's put a bench. I don't know if they would be able to access the bathroom if I put a bench over there. So yeah. Ego, what's that? Okay. I think this should help. And then this guy's stuck here. This should be interesting. Let's see if I break the tutorial. Oh, I actually moved. Okay. So we're already at the interview. Let's go for Richard Green. Take control of the thing, because that's the fun of it. Patient experiences intense pain in back. Okay, so let's go for physical. I wouldn't, I would be weirded out if I actually went to a clinic and I found the clinic like this without enough benches, an abandoned desk at the reception, no receptionist. This room that has tons of empty space. Okay, I know what you want, so let me just pause for a second here. I know exactly what you want me to do. Speech listening, no, it's not that. Something's for large center union, no. Let's get an X-ray. Go get an X-ray, yeah? Yeah, you're gonna have to go all the way outside. It's one of those clinics. You're gonna have to go all the way outside, go to the next door. Then you're gonna go through an empty room, and you think you're gonna die. Someone's gonna jump from the shadows and kill you. But keep going. There you find Mary Lewis. Mary Lewis will take care of you. In a good way. She won't kill you. Right, in the meantime, now I can... let me just pause a little bit. Let me try out the... Yeah, let's... That's it. I want to try out the interface here and the test interface, see how efficient it is, given the amount of things we have to do here. 7 hidden symptoms, okay. Chris is already doing the interview. Swallow pain. Swollen lymph nodes. Hoarseness, voice suspicion, sounds like breathing. Okay. Give me a physical as well. Experience difficulty, discomfort swallowing. Problem infection. I would love to have a lab here. I wouldn't enter this clinic for the life of me, really. Unless someone in the clinic said to me, well, we're still adapting. And even then, I mean, it doesn't look like they're following hygiene protocols here. Okay, we need something else. Cavity, I'm gonna go for laryngoscopy, I guess. Let me just see what else they have. Oral cavity. Let's go here. Okay, so we'll cover the symptom for you. Scoliotic findings. Okay. So you're gonna have to take drugs and exercise, man. That's it. And this guy has diagnosed the man. He has to go back into the clinic, okay? So let's go back to Robert Robinson. Yeah, okay, we have 100% of laryngitis already, so this is just to make sure. Didn't notice that we had this. Diagnosis is ready. Yep. There's one hidden symptom. I wish I could get all the symptoms. Infected larynx and vocal cords. Okay, but let's move on because I have to tend to 6 guys. 6 people during the... Yes, that's diet modification. Yeah, you feel free to use the bathroom. They aren't very happy with the clinic right now. You feel comfortable. You don't. You actually sat on the reception. Probably you don't feel comfortable because everyone enters and goes directly to talk to you, man. Thinking that you're the receptionist here. Well, your choice. I gave you benches after you arrived, but I gave you benches. Miraculous benches that appear from nowhere. We done here? Okay, get out of my office. I gave you the medications, I gave you the instructions, I gave you everything. Get out of my office, I have to take care of other patients. Go on, Robert. Go. I don't want to know about your insecurities. Go. Go, 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 go. Yeah, you have to leave your building and come to the other building in order to use the bathroom. Just put a door. In fact, it would be the smartest thing to do. Wait a second. At the very least, right? I mean, the place is a mess. It doesn't have to be such a mess. Let's put a pink door here. No, I can't. Well, I'm gonna have to move the trash can. There. Cramped little bathroom. And you gotta lock 2 doors. Remember that, boy. Okay. Who's next? You're really... You're really leaving him sitting down there. Yeah, he's getting pissed. Okay, we could give them coffee, maybe. They don't have enough bathrooms here. They're not hungry. Yeah. She couldn't sit, and it's an ugly environment. Yeah, it's... Okay, let's give you... Where is it? These are doors. No, these are the walls. Oh, here. Let me give you. I'll give you the miracle of plants. Yes, plants. Okay, not in front of the door. Let's put one here, one here. Let's try and embellish this place. Notice board. I'm also gonna give a clock so you know how long I'm taking. And start asking yourself why I'm stalling. And screwing over with you. And it is an ugly place, they are right. Balloons. No. Okay. I bet the balloons would make a lot of people happy. Lighting. Decals. No, I don't want any decals. Just, yeah, put a pharmacy cross. Nah. Yeah? Nah. Is there a coffee machine here? Coffee machine. That's what we're looking for. Maybe a TV. That will distract them. Oh no, bookshelf. Bookshelf outside here would be nice. Yeah, right in front of the window. Yeah, I don't think so. But here, maybe. Yeah. So go read something while I wait. I'm gonna put another bookshelf around here. Right above the plants. Oh, I found a coffee machine. Yeah, since I'm not using the reception table, why not? Put a coffee machine over there. Okay, this should help, I think. We'll see. Things appear magically in here. Well, she's very uncomfortable because of the bathroom thing. Okay. Now, in the meantime, let's talk to Mary Hill. Already? Okay, so it's sinusitis. Here. Get your spray, get your analgesics, and get out of my office. Go. Christopher, you're a diagnosis machine, man. Probably if I get doctors that don't have such a nice level of diagnosis, they would take longer. I'd have to submit the patients to more exams. It would take longer to satisfy them. And okay, yeah, you're really pissed, aren't you? Okay, really pissed. You're still finding the environment ugly. Come on, I just redid the whole thing because of you. Couldn't wash hands. Oh, now the trash can is right in front of it. Fine, give me the trash can then. Enter build mode. No, I want. Give me the trash can. Need a mirror. I can't really access the trash can. See? Okay. It's here. Anywhere, okay? I just want to move so she can actually wash her hands. Fine, put it here. Well, let's pray to God this doesn't. Yeah, I cramped it too much. Fine. Let's go do this. But come on, can't you move a trash can, man? Now you're just staring at the coffee machine, probably asking, why did they give me a coffee machine if I can touch it? Because I didn't wash my hands or something. Yeah, the office is a mess. That's the point. Really. Looked like somewhere where a mass murder event would happen, or I don't know. Or a horror movie. hell. Who's next? Well, if you're so dissatisfied, just leave. And they hired me because I knew what I was doing. Well, I went for cozy. Clearly, I ended up with messy malaise. Okay, you're gonna do chest auscultation. Okay, then go do it. That's your choice. Go do it. Yeah, pick up a book, have fun. In fact, that's probably a stack of those old magazines. Pottery Barn catalogs, old catalogs from the 90s. Procedures are finished. Patient is waiting. Okay. What else? 4 hidden symptoms. Give me a physical, man. Shingles. Again, another person with shingles. Okay, so antivirus, analgesics, rests, steroid cream. Yeah. You're just waiting here. Sorry for you. But instead of just handing out the diagnosis and the medications and all the recommendations, and sending you home, Chris here isn't really keen on doing it. He wants you to wait. I think he doesn't like you. Alright, Mr. Green. We're done here, right? Get out of my office, Mr. Green. I actually thought, no, I actually exchanged, I thought, yeah. Oh, no, yeah. I was clicked on, I got distracted for a second. No, let me, yeah, okay, let's leave, let's leave on controlled by doctors. Let's see if the doctor actually calls him next. I'm feeling sorry for the guy. I mean, it seems like that I don't have control over who they call. Patients just get in the order they arrive, so you know. But I don't know. Chris looks like a brilliant doctor, but one that's really pissed off with his patients apparently. I mean, why didn't he call this guy, man? Apparently it's a small city. I mean, look at the clinic. Does he hate the guy? Does he know him and secretly hates him, or openly hates him? Can you? Oh yeah, I had to. They don't leave unless you actually shift control by doctors. Interesting. Okay, next. Next. Come on in. Oh yes, Charles Brown. We studied together, didn't we? We used to call you Peanuts. Sphagia. Patient experiences difficulty or discomfort of swallowing. Okay, it's pharyngitis already. Okay. Yeah, okay, you have pharyngitis, but you didn't even listen to the rest. Yeah, it's pharyngitis. Just take this medication, go home, change your diet. I don't know. Eat more seeds or dog food. Lots of rest, lots of water. Take this medication. Get out of my office. Go on, Peanuts. Very anticlimactic. I expected more of the legendary Charles Brown. I'm also happy to see that you grew some hair. Best regards, Snoopy. Did you marry Lucy after all? Oh, they two hated each other. Okay. Wonder if the doctor's Linus. I just thought that Linus would be a doctor. For some reason. Next. Oh, Mr. Green. We're sorry for the inconvenience. We didn't mean to leave you behind in the waiting room for such a long time. Here we know you're in terrible, terrible pain. Take these analgesics. Nice solid doses of Toradol for your inconvenience. And lots of exercise. Do come back anytime. You're lucky Christopher can't take the doors out himself, because he would keep you in prison here like as if it was a game of The Sims to see how long would you would. In fact, well. Prefabs. Select prefabs category. Building mode. Prefabs. What do you want now? You can see different rooms divided by departments. Choose any of the prefabs and place in an occupied area of your clinic. Saved templates. I want a lab. Traumatology. Infectious diseases. Yeah, we have lots of infectious diseases. Might be an idea. Internal medicine department rooms. Orthopedy, cardiology, neurology. Department rooms, medical labs. I'm gonna put a medical lab down. Restroom, common room, cleaning closet, hematology, microbiology, hematology. Duh! Look at this place. Look at this. Look at the size of this thing. It's a beast. Wow. Wow. Okay, I'm not gonna put this down. Well, any room in here is way better than the rooms I built. Like 6 computers, shelves, archives. Wow, that works, man. Are you sure you hired the right person for the job, man? I could put the surgery room, couldn't I? No, apparently not. Let's see the radiology department, just because I'm curious to. No, this is a common room. We have cardiography and sonography. Man, I suck at this. Look at the differences. Wow. Okay. I understand why they're calling my rooms ugly. Fine, I'll put a gift shop. Yeah, it's the least humiliating thing, the gift shop. Oh my god. The service office. I could put a service office in the back here. Oh, let's plop it down. Just a... Wow. Really? Even the service office looks way better than what I built here. Well done. It's easier riding a bike, isn't it? I wouldn't say that. Oh man. The humiliation. Alright, let's go for the third tutorial then. Make sure you build a big enough pharmacy. It needs to be ready for a swarm of patients released from hospitalization in the morning. Fantastic. Hi boss, with diagnosing and building one of the out of the way, we know that you have one more talent that's also might need a little refreshment. I'm not so confident anymore. Let's take a closer look at the hospital management. Okay, no, this is more of a beast. Switch to department management mode. Okay. All the information about your selected department, assigned staff and rooms. Checklist for making departments work. Okay. Can choose who will be the chief doctor. Be careful in this selection, it can have a big effect on the overall productivity of your employees. Fine, so let's see. Chief doctor, Fraser Martin. Weren't you a psychologist, Fraser? Dr. Fraser. Who else? Paul Wilson. No, Fraser has way more experience. Apparently, Jane Garcia. Yeah, I really... Mr. Anderson. Jane Brown. And John Taylor. Okay, Taylor's an intern. I don't think it's a good idea to put an intern. Fellow. Specialist. Yeah, I'm gonna put John Anderson. Go on, Mr. Anderson. Next, certainty level is an important setting for diagnostics. It determines how careful doctors are when selecting final diagnosis and how careful they look for hidden symptoms. So medium, high, or low. Okay. Of course, I guess the highest they go, the more specific they will be and the longer they will take. Workplaces consist of a desk, a chair, and a PC, and when built correctly, they will show up in management mode. You hire your employees through them. They show both day and night shift. Let's have a look at your hiring options. Click on any empty workspace, without a portrait to open up the hiring card. Okay, so any. What do we have here? So we have a few diagnostics room, emergency rooms. What's this? What's this red one? Yeah. Damn it. We'll come back. Shared room staff, day and night. Okay, let's work with this. Let's work with these consultation rooms and the empty workspace. Open hiring card. Boom. There are 4 categories: doctors, nurses, technologists, and janitors. You can see their experience level, skills, and their requested salary. Also, the character perks can make a big difference and are often hidden. Fine. Next. If you're not happy with the candidates, a hiring agency will be happy to provide you with a new list of uncovered hidden perks for free. You hire any employee by clicking on their portrait. You can also assign any workplace from the employee card. If you're hiring an employee, you can see their allowed roles on their workspace. Sorry. Yeah, you're a specialist. You're expensive, but I'm leaning towards you. General medicine, diagnosis. See what do these things do? General medicine qualification allows the doctor to do all basic examinations and treatments and affects their speed. Oh, diagnosis qualification level affects how often the doctor will misdiagnose patients or have to consult other doctors. Acute medicine gives access to specialized procedures for diagnosing and treating critical patients at emergency. And anesthesiology requests required for the doctor to act as an anesthesiologist at surgery and gives extra survival chance to collapse patients stabilized by this doctor. Decreases death probability. People can die in this game. Okay, obviously it's a hospital, but I was not expecting this. Decreases post-operative go. Okay. Suddenly things took a turn to the dark here. Okay, I'm hiring you. Welcome aboard. Okay, any employee's card. Let me check this guy here. Level skills and specific technologies and nurses are experience levels for doctors 5. Please level up. Okay. Okay, Fraser, talk to me. Yeah, I see that Fraser isn't really happy here because of the choice that I made. Because Anderson is his superior now, I think that Fraser expected to be the top dog here. Well, what you gonna do, man? Skills are fixed for each type of personnel, but get improved by being used. You can learn more about individual skills in 2 tips. Yeah, that's the stuff I read. Wow, you're the king of diagnosis, man. Diagnosis ninja, certified. Specializations give the opportunity to work at certain departments or rooms and allow the employee to perform specific examinations or treatments. So, advanced diagnosis and acute medicine. Okay. Doctors can have 1 or 2 specializations. The first one allows basic work at a certain department and is available for all residents. The second one is usually related to surgery or diagnostics and available for fellows. Okay. I see. Cool. Employee roles give you the option to control what tasks each employee is allowed to perform. This way you can make sure that you have staff available when they are really needed, or for example, for surgery. Fantastic. So diagnostics, assisted surgery, trauma center, anesthesiology, surgery. Yeah, fine. Management tools for the whole hospital. Open hospital management card, clicking on the categories of the main panel. Can I see the entirety of the main panel? Okay, this video is gonna hiccup a little bit right now because I'm playing on a window. When I pull the window up, the recording device just chugged, so to speak. So as I was saying, let's take a quick look at management tools for the whole hospital. Open hospital management card, clicking on any of the categories of the main panel. So right here. This card contains 5 categories: department statistics, insurance, ambulances, budget, and statistics. Check them often because they will give you feedback you need for running an efficient hospital. Insurance companies, ambulance. So I have 2 ambulances, no calls. Budget. Let's see the budget. I'm very curious. Yeah, I have no budget. Basically, someone's pouring. Very suspicious, but this hospital is getting money poured, and I can do anything I want, hire anyone I want, fill the hospital with anything I want, apparently. no cost. Oh, no, this just mentions bank loans. Okay, so I have no loans. But when, here, 100,000. Yeah, I don't think this has moved an inch after I hired another doctor. So someone's still paying my bills. Suspicious. Staff. All right. Patient 0. Yeah, it's a hospital that has no patients. It's a facade. A hospital in the limbo. Okay. Can't help but feel that this game would feel way more comfortable being played on a larger monitor. I'm playing on a laptop monitor right now, so yeah. Okay. Next, now onto the fun part. Our hospital needs functional hospitalization process at the general surgery department. Switch to department management and select general surgery department. Fine, so department manage. Let me just enter here. Check what rooms are missing at the general surgery department and build them. Remember that rooms with red numbers next to them are mandatory. Yeah, okay. So, general surgery department. Yeah, there are no rooms that are actually missing apparently. Remember that rooms with red numbers because yeah. No. Yeah, there's nothing mandatory. That isn't built. I could just put down a reception apparently. Well, I have 2 empty rooms here. I can just put general surgery. Let's put general surgery here. Right. Good. And yeah. Okay. Can I access a dress code? Oh, it's on this side. I see. I was actually looking here. I thought that fine, because of the little symbol general surgery. I thought that it was here, but it's here. You need an HDU. Fine, let's build an HDU here. Die. There. And I need a surgeon. Okay, so I have the HDU. I have at least the area for the HDU placed down. Let's go for prefabs. Lounge, sonography operating. Okay, I have 2 HDUs. One that fits perfectly. Let me see the other one. Yeah, it's a very small one. Yeah, this one looks cool. Let's put it down. Surgeon. Day shift to an on-call room. If you hover over the professions, tooltips will advise you which specialization is required. They can be filtered in the hiring card. Yeah, well. Okay, let's click here. Surgeon. Here. Perfect. So, who's it gonna be? I'm gonna get the best surgeon. Oh yes, there's a difference between general surgery, examinations for prescribing treatment at general surgery department, and allows doctor to assisted surgery, and operative surgery to act as the main surgeon. Oh, I need a main surgeon. Yeah, it's you. You're the Richard Scott. Fine, Scott. Welcome aboard. Now that we have working hospitalization, the ambulance will bring us for our first patient. It should be only a minute. Okay. Yeah, the first one. You actually put up the circus for one patient. Amazing. And it's gonna take a minute, alright. I mean, the creature has to enter the hospital and traverse every part of this hospital in order to reach any room. Look at the size of this beast. Oh, no. That's even better. Fraser Hall. Mr. Hall, you're arriving. On a bed. Fine. Take the patient under your care. Yeah, fine. Now let us follow the patient through our hospitalization process. This can start at the emergency department with observation and trauma hospitalization. Get admitted for observation when there is no clear diagnosis and the patient could have one or more dangerous symptoms. Once the diagnosis is clear, the patient gets treated and sent home or hospitalized in a specialized department. When the patient goes to an observation room, following examinations will be done by the on-call room staff, and your doctor in the doctor's office at the clinic will take another case. Handling different types of traumas and accidents and most critical cases that your ambulances bring the hospital arrive here. Trauma center works the same way as the observation room. As long as diagnosis is not clear, the patient will be examined here. Fine. Reach a clear diagnosis. Alright, fine, let's work it out. Okay, I think it has something to do with that blood stain on his coat. I'm just guessing. Okay, let's pull up the sheet. Let's go for auscultation, physical. Come on, Dr. Brown. Alright, let's see. Yes, abdominal injury. Blood loss. Also called hypovolemia. Describes a significant loss of blood volume. Hypovolemic shock. Condition due to blood pressure being low. State of blood flow. Open wound. Yeah, I think it has. I think the ballpark here is he was stabbed or shot. I don't know. For the love of God, let me take this out. Just go for the physical woman. Yeah. Well, at the very least, she's actually giving preference to this. Yeah. She's stabilizing the guy. Procedures are finished. Okay. Fantastic. So, do a physical. Go. I mean, I don't know if it works like this on the traumatology center here. No, let's go back to our patient and wait. Trauma center. Try to find out what was wrong. Reach clear diagnosis. Ah, okay. Yeah. That's what I gotta do. Yeah, so where did the doctor go, man? Pause this. Easy to use and effective method for monitoring patients' oxygen saturation. Special ultrasonography method used by evaluation trauma patients intensive. Yeah, I think you should go for this just to see if there's any internal damage. I don't know, but trauma center CPU. Okay. Look, can someone take care? There's blood on the floor. The guy just arrived because he was shot, stabbed, wounded somehow. Someone mind tending to him? You just left. God knows what you went to do. Did you go to the bathroom? Did you at least wash your hands? Jesus, woman. This is problematic, critical. Come on. Okay. Yeah, things just got serious. Yeah, that's what I should be doing. A physical won't do it, I think. Still have one hidden symptom, and I think the only way to get through it is to just do the fast assessment. I'm not gonna do palpation on a guy like this. Okay, so spleen rupture, ICU hospitalization, pressure bandage, blood transfusion. Yeah. Regular HDU or HDU hospitalization. Regular ward is suitable for patients without any risk of life-threatening conditions. Units for patients at risk of collapse of life-threatening conditions. They are generally equipped with live monitors to keep an eye on the vital functions of their patients. Sent to ICU and connected to life support and to get continuous care, intensive care when unit is not hospitalization type, but also a standalone department. Emergency radiology, medical labs, intensive care. I'm gonna send you obviously to intensive care. Alright. Let's speed things up. Where does she go? Where is she? I mean, what are you doing, Jane? Oh, you don't have... Yeah, you don't have an office here, so you have to move towards the office here too. Assign stuff. You put him back on his blood filthy suit. Impressive. He's still wearing his suit and his shoes, isn't it? I know he is. Come on, Harris. Alright. Go to... Okay. He's on another level, I think. Yeah. There he is. Yeah, I knew he was still in his suit. Man, you could just change his clothes, couldn't you? My god. I'm also happy to see that you have stopped the bleeding so well that there's blood all over the floor. I can actually track the guy through the blood, my god. Work around the clock, and there are a few important times in the daily schedule. Doctor's rounds happen every morning. Doctors visit their patients in order additional examinations. Nurses check the patients regularly, more often at HDU and ICU. They can notice dangerous symptoms and notify the doctors so the patients get examined. Nurses also deliver meals and medicine in various forms as prescribed. And when everything goes horribly wrong, well, sometimes that happens even if you do everything right, and patients will die. Death can be turned off in options. The patients will be transferred away instead. Oh. So the game allows me to not play violently. Treat your patient. Yeah, in all seriousness, this is very sensitive stuff. I mean, everyone has had someone that has been hospitalized, especially after the last 2 years. So, not everyone survives. So, yeah, very mature choice here. Treat our patients, suppress all high hazard symptoms. Some might be still didn't notice some icons or pulse. The patient might collapse and die. Okay. So blood transfusion. Well, yeah. Well, I think I did what I should have. Procedures have finished for diagnosed patient. I don't think I have anything else that I can do. Let me see available treatments. I still can go for abdominal surgery. Then let's. Attending, yes. Sheesh, what the hell happened to you, Fraser Hall? You're gonna haunt my dreams and nightmares, man. Because, well, I mean, I think you got stabbed here, or I don't know if a bullet comes out after the surgery. Then I know you got shot, but I think you got stabbed. All important, or maybe you were in an accident, but it's just that. I mean, just that one bruise, that one cut. Oh, I can focus on why we requested your help. Please meet us in our next hospital. Okay. Yeah, let me see. Just let me check on this guy. Let's see how surgery goes first. Because if I click next, I think they're gonna throw me into the campaign. So let's end this, in fact, with the surgery of Mr. Fraser Hall, the mysterious man that appeared stabbed. It looks like a Highlander movie. Someone enters the, well, he should be healed if it was a Highlander movie, of course. But the guy appears on the hospital. That mysterious entity appeared in the hospital, like John Doe, that old series with David Purcell. The guy appears on the hospital, and no one knows what, why, or how this guy got injured. And there we are. We're just okay. The whole team's here. They're actually animated. Wow, look at that! They actually animated the entire thing. I want to see if Fraser Hall is going to survive. So the guy just appears. We know nothing about what happened. We just know that this guy's punctured and he has a spleen rupture and he needs surgery. And for some reason he's still bleeding all over the floor. Oh, okay, yeah, on the it's raining outside. On the surgery room, I think it would be blood would be a regular sight. I don't know if it bleeds all over the floor, if they let the patient bleed all over the floor, or what happens. I don't know. But there's a lot of blood here. Oh, they even put the. There's even someone rolling the screen there. Oh. Judy Barkley. Alright. So is Barkley the... Elizabeth Barkley. Okay, so... nepotism much? I mean... all the Barkleys work on this... on the surgery... on the surgery... wing of the hospital, is that it? How's the patient? Oh, okay, now you got funky kung fu pants here. Fine. Yeah, there are still 2 hidden symptoms. What should we do then? Okay, so we should go for blood analysis, I think. I mean, I know he's punctured, so let's try and discover what else do we have here for this before Mr. Hall dies. Speed up things a bit. Okay, you're back there. Who's treating him now? Judy. Judy White. Okay, Miss White. Ms. White, I don't know. Go on and treat the guy. Ooh, this just ramped up. Oh, I really find. Okay, I don't know the point of doing abdominal palpation, especially after a surgery. I mean, I looked inside you, so I'm gonna palpate the area that I just did surgery on. Doesn't look very smart. Okay, we have one hidden symptom. Oh, okay, we have sepsis. Risk is high. Caused by body's own response. Yeah, so... Antibiotics, now. And... Okay, let's do a physical. Yeah, intravenous antibiotics. Collapse the smallest parts of the lung tissue. Sedation and magical ventilation during surgery. How do I treat this? Wow, man, you're really struggling for life. Okay, oxygenotherapy. Oxygen to inhale gas. Wow, when the situation is sensible, it really demands attention. All of a sudden, this game just ramped up. Okay, suppressed. Okay, now we wait. I don't know how it's done now, if it's an RNG or what. But there you are, I think. Well, we did everything that we could for you, sir. That's it, mysterious Mr. Hall. Let's see if you survive. I don't know how long should I wait here. There's no clear diagnosis. Oh, okay, now I started losing other patients. Fine, let me see, go to... Well, I can actually play this little hospital here. No clear diagnosis. So let's see, you have fever, sore throat, oral findings, painful lymph nodes, red swollen, back, could be tonsillitis or viral tonsillitis. Yeah. Well, I'm gonna put you in observation for tonsillitis. Whatever. Yeah, okay, let's end this. Let's just hope that Mr. Hall has survived all this. And yeah, we'll come back soon enough with the first chapter of the campaign.